openly told them what's happening with bad air quality, bad food quality, bad water quality. They have done all of this, and he's on the forefront of that, sometimes at the risk of even having his license removed. I need you to give him a big hand for his bravery for doing all this medicine, and the knowledge that he's got is outstanding. If you have an autistic kid and you want to consult somebody, this is the gentleman you need to consult, not even me. I have far much more to learn than what he has as far as autism is concerned.
It's a mutual kind of thing.
So,
I learned
for
from
it,
you.
let's have you up. You've got 30 minutes. I know 30 minutes is less for you, but please finish in 30 minutes. All right, I have a full page, and I'm not going to read it out. It'll take me another 10 minutes, right? But he's an awesome gentleman, so please listen to him.
Good morning, everyone. I would like to start with because we had enough of it, Sayara, everything and all that yesterday. We'd like to go with the subject directly, and it was awesome. Already Rajshekhar has set the stage talking about periodontal infections, cardiac cases and all that. I'll just give you a small thing. I happened to work with one of our close friends, and he was rushed to the hospital with the ACS. 49-year-old gentleman, had some history of ILD, but there was not that kind of this one. And during that hospital admission, the first thing they checked was the blood test. CBP was done. CBP showed high levels of leukocytes. This gentleman complained of some pain in the teeth also last week, and by the time he was shifted, he was declared dead. So it was somewhere we were trying to see what might have gone, but when the results came with that CBP test, and I know this guy was having some pain, there must be some infection and all that, but something, it's a kind of still. Yesterday Anupam was telling heart attack kisi ko bhi aa sakta hai, so he was scared not to dance and all that. But calcium score progression is the one thing. I'll try to start with a thing called Dr. Pauly Raggi study. As a radiologist, I had been working on that CT score, coronary calcification score, and you are going to get cases now, and a cardiologist also will be asking you what can be done for that. So let's try to explore this particular thing of what this Raggi study was, and he was able to prove out that this is a better marker, and the progression of the calcium score is a marker for ongoing atherosclerosis. So this is what everyone is talking about, elephant in the room. Elephant in the room is we're not able to see that particular stuff. We're not acknowledging. In India, in Delhi, we have such everywhere out, we have such a huge pollution. We talk about air pollution, we talk about water pollution, it's all into the thing. So we need to really look into this. There was a study which showed coronary artery calcification correlation with the cadmium levels. Here I can tell you cadmium levels, when you look into the blood, they may not be shown. But if you do a chelation, in the sense give a DMSA dose, and after 2 or 3 days you check out that urine, you'll find out that. I'm just giving all the things. Coronary artery calcification, because this is one thing I had, my Bade Papa was also having this coronary artery calcification. The moment any vascular calcification, we think of something like diabetes causing that, right? So this is a very rampant thing, and it was picked up in, this is the study, this is the ancient Egyptian mummy also had shown this kind of things. X-ray wise, we used to see that aortic knuckle calcification. Every X-ray used to do aorta, they have a calcification, and used to, yes, he has got atherosclerosis and all. Now that different modalities are there, you do a angiography, filling defects and all that, you do a this one, SPECT scan, and this is what is this particular stuff, or calcifications. And this quite rugged calcifications, And we have got this thing called, we quantify it by Agatston score. And what we have been, when we were 20 years back, we met, we were all into the same kind of zone. We were trying to understand everyone is having a normal cholesterol, but still they are getting into ACS. We had done a study with a limited kind of things, and we felt the people who underwent stenting as well as bypass, their levels of cholesterol was below normal. It was not, that was really unexpected, this one. So already we have been talking about it. So I'm going to talk on how you are going to monitor this and what can be done for this kind of cases, because this is the place where as an integrative medicine, we are talking out of the box. When I started this, initially when we used to come to Goa and all the things, and my family is of doctors, and they said, okay, there must be some sponsored trip, must be for a dog. You are going, and you are going to Goa. So the thing is, perceptions of different people are different. When you start doing something different, I was talking to that gentleman, anesthetist, who came all the way from Jangaon, and okay, Chal Akela, bhai, you can sing that song, Chal Akela. Chal Akela, Chal Akela. I can, Ekla Chalo Re, Bengali mein, right? So you need to, you are trying to make a difference to the patient, you need to take some extra effort. You can't just go within the rule frames and all that, only do that particular stuff. Yes, this is a kind of thing where if you get a case like this, try to do that and you can score over any of the things. The big picture is, we know cholesterol history, this is all falsified. We are talking, now that we talk about something like LPA, we talk about LPA background is endotoxemia. With endotoxemia, LPA is increasing. And finally comes to, there is a theory, stealth infection in the mouth, which Rashika was telling. Stealth infection, it doesn't show up like that. You have a lot of things in your thing, and it can just manifest with a bad breath. So stealth infection, leaky gut. Leaky gut is another major issue. All this predisposes for the calcification as well as the cardiac things. So this is, I'm just giving references. I think this is the repeat actually. This is also one of the references where relation of coronary artery calcium to serum lipoprotein levels were found, and autopsy studies showed no correlation between cholesterol and atherosclerosis. So these are the things you can always, there are references, we felt this is the need of the hour, and we usually talk about this endotoxin lipoprotein hypothesis, and the thing is, we can always, what is the common denominator for this? Why there is a, still, Haridwar, I'll be glad if you answer this, right? I'm going to put a question. Why females don't, premenopausal females don't get heart attack? Anything? They give all the attention to immediately to their hubby. The moment hubby comes, they give everything. Now males have more estrogen, I can prove it. There's a food for thought. Why does Haridwar ke bazu Rajendra Mane is there? Rajendra, I'm not trying to tease you. Why heart attacks occur only in the middle of the night or in the early morning? Think, food for thought. Next conference I will ask. Atherosclerotic plaque, what is it? Yeah, it is as simple as that. We tried helping out our patients, asking them not to fill his stomach during dinner time with a lot of carbohydrates. The more the carbohydrates, your insulin surge is very high. The more the insulin, the more the sympathomimetic effect. All the things goes into vasoconstriction. And if there is already some small things, it will put that. So corporate hospitals, दिन में चलता नहीं है बेचारा, जैसे रात में इसका चलता है लिरॉय का, ही इज वेरी एक्टिव इन द नाइट. So what is atherosclerotic plaque? I try to correct this particular dots here. Correcting the dots is important. When you correct the dots, you need to look at retrospective, look at what is there in that. Activated left upper vein and all that. I will not go much this particular stuff, but we were only working on that TNF alpha and all that. TNF alpha and all that, I think I came to know just before the COVID or something like that. I was not aware what is cytokine storm, TNF alpha and all that, because it was not measurable. We used to read in the theory and leave it. So these are the things which are one of the reasons why you get this atherosclerotic calcification. You have got monocytes, you have got some osteoblast and all that. That forms that particular calcification. This is the genesis of how things happens. So now we have reasons to believe that because of the calcification is because of the bacterial component. You are able to the study which there's coming up. This vascular calcification is a sequel to the chronic infection, which was stealth infection or something which is persistently harboring. Otherwise, calcification cannot occur. I gave you the first study about urinary cadmium levels. The second, this particular thing is probably a infection basically. So infection, let us try to explore what are the other areas you get that calcification. We used to talk about metastatic calcification, dystrophic calcification. This is a simple, let us see. This is the case of a chronic constrictive pericarditis. Is it because of cholesterol? No. This cysticercosis, is it because of cholesterol? No ways. So why only coronary calcium which is deposited, and it is being told the narrative is it is because of cholesterol. And he is being put on more statins, the statin is increased. You add statin to a person who doesn't have coronary calcification, he gets into calcification. Because statin itself reduces vitamin K2D3, K2MK7 it reduces. So this is the number of things regarding all this stuff. And what is the evidence for infection in atherosclerotic plaque? People have already worked out. You have got these reviews in microbiology that way, or you have got all things are peer reviewed, can be always looked into it. And there was a cultivation of this microorganism from the diseased tissue. This was much demonstrated. So now the $1 billion question is, you ask if someone knows that you are doing chelation therapy. The moment I said to my family members who were one is ophthalmologist, one is a cardiologist, one is a dermatologist, chelation कौन pressure going? Is it legal? We with this particular thing will try to show that all things what you are doing is evidence based. It's all kind of thing, legal part. You always try to see that retain all the records of the patient, even if a small monocyte count, small lymphocyte count also matters. We can always, so chelation was, when we started 20 years back, we were dubbed as alternative medicine, अरे ये हट गया माले से. Now the same people are coming, they are asking us what to do with this coronary artery calcification. Yes, so we are back, boss. Yeah. So what are the things which you do is amazing. Yeah, garlic. I can always tell you aged garlic extract. From there you get something like uric acid. Aged garlic extract. How do you make it? Just put some garlic things in a alcohol, absolute alcohol or normal vodka and all that. Vodka. Absolute vodka. Keep it for not less than 30 days, Lady. And you just take that 1 spoon daily. It makes a big difference. This is really helping that. EDTA do help. I try to focus more on the 3-hour part only here. The marathon cyclic thing changes, that makes a big difference. Proteolytic enzymes, reactive ozone, I need to know the time, 16 minutes, okay. So bacterial derived signal, okay, these are all I'm trying to make myself more assertive. Why all these things? I'm just trying to give a short story. I'm giving a lot of references for that. Yeah, Rajshekhar, you were absolutely right when you said this is the one thing which happens. Yes, most of the doctors they ignore. Even if you open the mouth, you may not find anything, but still, under something is there. This intestinal bacteria, atherosclerotic plaque has a micropolygal infected biofilm. So many case references about that. So what is that I'm talking about? This is a normal thing, this is slightly calcification, this is the moderate calcification. I think I missed on my case actually. I think I'll show later. So the thing is, most of the patients who come to you, they are all trying to have their proper figures, cholesterol ठीक sugar maintained all vitamin D is normal. Now we don't have to tell them to go and get it. They do by themselves and come. So like that, they are now going for a cardiac screening also. They come with this particular calcium score. One of a gentleman called, I'll share his study. He came to me 4 months back with a calcification score of 2,200, something like that. Okay, I'll just share that. So he was 78-year-old guy, non-diabetic, but he doesn't take a proper, he cannot do a treadmill test at all. So how can we assess that particular stuff? So based on that we started. He was given some diagnosis and all that. Moderate to severe stenosis, you have got the blah blah blah. And because of that calcifications, we are not able to correctly estimate. And he was told to go for bypass surgery immediately. Your cardiac surgeon also was not very keen on getting that bypass because he knows we cannot meddle that particular stuff. So periodontal, I think it is repeating here. Baseline calcium score is a powerful thing. As you have a baseline ECG, you should have a baseline coronary calcification score. And if your calcification score is increasing on a 1 year follow-up or 2 years follow-up, then there is a need for concern. Okay, and I just thought it was AI. It's not AI here. It is all on statins. So among the 495 asymptomatic patients, and 41 got MI within 6 years. So we are talking about now medicine, precision medicine, predictive medicine. We are talking about the preventive thing actually. So we need to see what is going to happen 6 years down the line or 10 years, right? This is the kind of, this is the ultimate message. If the calcium score doesn't increase more than 15%, you are probably very safe. Okay? What happened? What the thing? I'll tell you what is the mainstream people are talking about. They are thinking the calcification. When you give a EDTA, it will vanish. It doesn't go like that at all. If you are able to manage that there is no progression of that calcification, you have done a reasonably very good job. So again, this is there are non-progresses, there are progresses. We have got this particular stuff, and yes, out of this 4,609 asymptomatic patients who had a calcification, all their mortality data, when we looked into that particular thing, non-progresses are having a better this particular stuff. There's no morbidity and mortality in that particular things. Yes, diabetics and diabetics, non-diabetics, they have a low incidence compared to diabetics. And Lenny, I think all of them, all non-diabetic TAC trial and all that, I think everything is something lead or the arsenic causing that particular stuff. And statins, again, Lenny can give a 1 hour talk. And I remember we called one cardiologist was talking for statin, and we both took left and right. I think he never came back later. So this is a paradigm shift, this study and all that. And there are references. I'll try to give you the tips. What can be done if you have come here, you are already thinking laterally. You are not going to buy the same narrative, cholesterol causing heart disease and all that. So what best can be done? Because this case is, this scenario is, it is your pitch here. You can always, you can hit out 4, 6 and all that. You're not going to get out. Spin makes it there. So leaky gut causing LPS, and it is again due to this endotoxemia. And I think we were discussing with some doctor what can be done. This is clearly, you can always take up this particular stuff. I started writing vitamin K2, MK7 from a very long time. Magnesium is to be supplemented like anything. Aged garlic extract, that is called uric acid. Uric acid, our people can manufacture this uric acid. This is going to be a big kind of thing. Capsules we get from US, Lenny, uric acid capsules. And all things, phosphatidylcholine helps. You have you need to work on that leaky gut. You have to stop using that stupid wheat. That's a big kind of thing. It causes a thing. There is a doctor called Dr. Watson. Try to look into his work, and he is a cardiologist. He and his wife, Dr. Wolfson, Wolfson, and he swears by leaky gut and in this wheat protein causing heart disease. He swears by that. By the way, he is also one of the leading guys, and he is pro anti-vaccine. So the aged garlic extract, how does it help and all that? You can just always have that. It's a very it's a very simple thing. Yeah? Our Indians we know how to enjoy garlic chicken. Khate hum log. I think it's very, very yummy. And fish is good here. I don't know about that. What happened to Samir yesterday? Garlic, all these things, berberine, you add anything, leaky gut. The thing is, leaky gut associated, I thought it was only autism, and I later knew that almost autoimmune diseases, whatever are coming, and they are also having a leaky gut. And cardiac also leaky gut. This is something locha. There's something in the diet or something in the soil, water, something is an issue. So leaky gut interventions, all that stuffs can take good here. Alcohol, I tell you this glyphosate, something like GMO food, something like NSAIDs, pesticides, they're the big thing. Adding berberine, adding L-glutamine, everything helps out here. So this, again, there is a thing called hormonal optimization of calcium score, and I think, I think I can always show on my cell phone. I think I have not. So that gentleman, what I was doing was 78-year-old guy. I started doing some chelation therapy. Along with that, we try to work on some other almost done. So now, after 3 months, because he was from a very elite family with a kind of thing, they said, no, we want to repeat coronary calcification score. So from 2200, it came down to 1800, and the stenosis, already he had moderate to severe stenosis, whole LAD was there. Now they have said on this particular thing, mild to moderate. And he's able to, effort tolerance also has improved. He was having okay. But the thing is, I'm still continuing the treatment actually. I'm trying to work on phosphatidylcholine and new things. I'll be happy, Lani, to answer any question because this is going to be controversial. Huh? Later, time is very much. 6 minutes.
Okay, ask.
So I am. Or else I will 6 minutes to khalunga. I can always sing some song.
No. Yeah, there is a question. Arpit, go ahead.
Arpit.
Phosphatic series are very let's talk about molecules. So since you have time, would love to hear.
No, phosphoryl we'll talk about some other time, not today. What he has to phosphoryl
See,
is a big topic.
I'll tell you.
One minute.
This case studies
1 minute.
and all that.
I just interrupt you.
Yeah.
He spoke about glyphosate. How many of you know that you cannot detoxify glyphosate? No chelation, nothing detoxify.
Lysine, you need to add lysine.
But there is one thing that you can do. That far infrared sauna that you have no outside. If you go and sit in it every day for 30 minutes, in 3 months, all your glyphosate is out.
But adding glycine also helps.
Glycine also helps.
Yeah.
But if you sit in the far infrared, that is the only way that you can detoxify glyphosate. And believe me, we say Monsanto is not in this country, but every damn farmer, every damn government agency is distributing Monsanto glyphosate to you in this country. Alright? I think you will agree with me. I think a lot of people here who know what's happening in the country will agree. For those of you who don't know, this is a revelation. Please remember, you may not get poisoned with non-veg food, but with veg food, 100% you are getting poisoned when it comes from the local mandis. Because you have bad sprays of pesticides and you have weedicides like glyphosate being used in every farm in this country. The government has made India a dumping ground for all of this. Sorry.
Come on, Lenny, I think you need to vent out actually, because what happens was, why I'm trying to tell you is, because when we started, our own family members, they said, why are you going there? What is that? You are a good radiologist, you have got a good setup. ये करने की जरूरत क्या है? So now with this kind of cases, whatever we started doing, it reaffirms your belief. Now that the cardiologists are walking in for a day, they want to do something can be done that. So I'm not giving the simple answer for them. I just ask them not to take garlic and go. Garlic pearls also was one of the things. So let us try to work it out. I think it's an amazing platform. Every time I come here, दिमाग की बत्ती जलती है. And thanks to Arpit, वो पानी में बैठ के भी बत्ती जल गई थी. It was fabulous. I think Lenny, kudos here. Fantastic. Yeah.
Since this is we are talking about a cat,
Yes.
I want everybody to know about this, that there is a movie and that documentary is available on YouTube. The name of the documentary, please note it down, you can search right away. The Widowmaker.
Okay.
The Widowmaker.
The Widowmaker.
Look into the toxicity work, what we were trying to work on that, Ellen Brokovich. At the same time, I gave you 2 questions. One of the answer was, I think it was evident. But again, there is a why the things happen and all that. What, Chal?
Okay, so there was one slide on this where he has given you what are the interventions that you should do if to reduce the calcification in your arteries, okay, the progression of calcium score. What we are going to do, you are all on that group. So I'll get Pallavi to take that slide out and send it to you. Pallavi, you can finish it. We will send it to you so that you have it on your phone. Whenever you see high calcium scores in your patients, open your phone and look at it and see what are the interventions you need to do. All right? Thank you, Praveen, for putting that slide up. Our next speaker, again reminding you of our next year's conference, please block your dates. Also reminding you that we are having that workshop coming up at the end of the month, and we have a special discount for each one of you. The discount coupon are also here. Our next speaker is coming all the way from the beautiful country of Malaysia. Dr. Janira, she has been attending as a delegate. Today I got her to speak. on something that I couldn't put together myself. A topic that is affecting every one of us these days. Every one of us, whether we are eating food anywhere in the world, drinking water anywhere in the world. The topic is microplastics, the silent